Our next speaker is Lisa Tushla, who's President, CEO of Terranova Medica. Terranova Medica is a strong CME partner with the MSG ERC. We've worked with Lisa for really a couple of decades through a number of different activities. And Lisa is going to describe the Fungus Education Initiative that is being sponsored by a CDC cooperative agreement. So Lisa, with that, I'll let you take it.
Okay, sorry for the delay. Can everyone see the slide?
Yep, looks good.
Okay, great. We're really pleased to be here to share something not so clinical, but a little more educational with the group. And we're very pleased to have been invited here. We've enjoyed a longstanding collaboration with the MSG and now are really enjoying working with the CDC on this initiative as well. So this project, this was a cooperative group agreement as part of the COVID outreach from the CDC. The educational grant was actually to University of Alabama, and then the University of Alabama worked with the MSG and our team to develop educational materials. Some of these are CME and others are what we'll call non-branded education. And so you're more than welcome to look at the MSG ERC site as well as the flagship site for this initiative, which is covidandfungus.org. We also have some of the continuing education activities. We've got one live on Fungus CME now, but there will be a second one launching shortly. So the challenge that we were up against, and I think this has been iterated in some of the earlier presentations, are some knowledge gaps regarding the awareness of the potential for IFIs in the severe COVID population. So as you know, there's a low level of awareness and the need to teach people to think fungus in general. But you know, you've got busy practitioners with a pandemic, and so to get them to think about fungus was very important. There was also a lot of confusion over the nature of some of these CAIFIs, particularly in mucormycosis in India. So we're going to go over some work that Alon did to help us address that issue very quickly when that issue came to forefront. The other question and issue you have is who is our target audience? As we know, it's not just ID physicians, but it's intensivists as well as intensive care pharmacists and nurses that need this education. And many of these are not experts in mycology. The other point that came to fruition very early in our discussions that there's varied resources in terms of diagnostics as well as access to therapeutics, particularly when the mucormycosis issue hit India. So it's important that whatever we developed had a community focus, particularly for those resource limited settings, which I'm sure Luis can tell you about some of the Latin American outreach. As you know, we have moving data. As the pandemic evolved, our infections of concern shifted. We had risk factors shifting as we started to get vaccinated individuals. But we, you know, it's nice that this agenda will cover some of those rarer infections or infections that are emerging beyond Kappa. We needed to be flexible in the way we were working with. We had a one-year grant to do this and to get some guidance out, but also to be able to pivot when emerging threats happened. The other issue that's interesting is there's, as many of you know, underserved populations are more likely to experience severe COVID and IFIs, but what is that driver and what are the best strategies to address that? So we've got some work that's going on in terms of looking at the research, but also addressing some of the need to get people vaccinated in these underserved populations. So the solution was really to create the COVID and Fungus Initiative, which was to raise awareness of the busy professionals to think fungus and get them the tools they needed to both diagnose and manage CAIFIs. And in targeting this population, we realized this is a large group of peoples with varied interests, so we used listservs, but we also used a Google AdWord campaign that allowed us to get education not only to healthcare providers, to those patients that might be looking up black fungus and some of those color coding documents that seem to be a little confusing. We also use social media and continued education promotion, and we've been working with the CDC directly on some of their social media campaigns and included a program with the Fungal Disease Awareness Week. And Alon Schwartz has been really helpful, and as well as Luis and Andre, to help us get some materials out via Twitter. As I mentioned, it was important to be responsive and to be able to move quickly with new findings. And we wanted to use convenient formats. So we used something called a care step pathway model, which we've used in oncology for secondary infections and other side effects, as well as infographics, as well as traditional live virtual events, videos, journal publications, and podcasts. So I'm not going to spend too much time on the initiative goals, as it would make sense that we really want to help people think fungus in these patients, but also recognize the signs and symptoms and perform appropriate diagnostic tests. Timing and appropriate selection of antifungal therapy. You know, this is we don't really know yet where prophylaxis and empiric therapy are going to fall. We leaned on the side of helping people recognize patients at risk and actually screening those patients and coming to a firm diagnosis. But as you'll see from some of our materials, it's really a question for people. Optimizing pharmacology of therapy. You know, we've worked with Dr. Johnson about this, and it's really important to recognize the baseline immunocompromised state and how that affects drugs delivery, as well as drug-drug interactions in these populations. As we know from Dr. Ostrowski-Zeichner, there's really some important infection control and prevention procedures that need to at least be considered, and this came through very loud and clear in the Latin American outreach that we did. The healthcare disparities, we're trying to delve into that with some research using databases with Dr. Badley. And we want to educate patients and caregivers at Kappa and IFIs. We were very fortunate to have some really fantastic patient videos, including a caregiver, Miss Angela Stroman helped us with that in terms of what is the perspective of the caregiver when you've got a sick relative in the ICU with a potential fungal infection. Okay, so I think you know many of these people. Dr. Pappas was the chair of this initiative, but Dr. Thompson and Bradley were very, very instrumental, and Dr. Jones was particularly helpful in bringing in a lot of resources and keeping this thing moving. In terms of our staff, it's myself and Tom Davis are the main people at Terranova, but Dr. Lyman, who's going to be speaking later, has been a wonderful partner to us as we've worked through this program. Our content development team is a wide range of experts in infectious disease, intensive care medicine, pulmonology, disparities research, and medical microbiology from the US as well as throughout the globe. So we're very pleased to report that our website for the COVID and Fungus Initiative launched in March of 2021, and to date we've had almost 22,000 visitors. The initiative has been accessed from about 151 countries and translated by browser into 187 languages and dialects. One of the values of our COVID or Google Ad Grant is that we can target different regions of the world as the pandemic changed. So that was really good for us because, as you'll see, the mucormycosis outbreak in India required a lot of geo-targeting. The content's been viewed evenly on mobile and desktop devices, and we think that's important to reach some of the underserved populations, whereas, you know, maybe people have access to a cell phone, but not necessarily a desktop computer. We've done a range of tactics. I'm not going to go into detail. You're more than welcome to go to COVID and Fungus, but as you can see, it's a lot of resources, it's live events, it's 2 Twitter open mics, and an infographic on mucormycosis. So we've really developed a lot of things, in particularly a podcast in conjunction with the IDSA. So we've tried a bunch of different tactics, and we've been monitoring how these perform with different audiences. If we kind of look at our tactics in different kind of categories, we've done guidance and research. So the Kappa CSPs that Dr. Patterson described is one of the main parts of this, but we did create a mucormycosis infographic working with Dr. Schwartz as well as some of his colleagues in India. This whole idea of the color miscoding was really brought to the forefront by Dr. Perfect and looking at the black fungus, and then it turned into white, yellow, and green. And so we actually created a document that provided some guidance on that. That's been one of our most successful initiatives that we think is being reached by both HCPs and patients. The OFID journal article is actually in press now, and so Dr. Badley led that. He's also leading some database research, and as Dr. Pappas mentioned, there's also a crypto registry. In terms of building the community, we've had 2 open mic Twitter events. The first was on mucormycosis. The second was actually in conjunction with Fungal Disease Awareness Week. That's been widely successful. The Latin American webinar that Dr. Ostrowski-Zeichner led was also very well attended and had a lot of interaction, and we're looking forward to learning more about the needs there. And then we did a number of case discussions on the care step pathways and the other materials. And so there was a call for cases where people from the community sent in cases and the challenges that they had recognized. And we workshopped those on a CE on expert guidance and a second continuing education on multidisciplinary care that's coming out soon. We also took one of the cases and worked through it in a critical care nursing journal publication with Dr. Jones. And that's been a really nice opportunity because the nurse who was the daughter of the patient actually came through and was able to provide some commentary, expert commentary about the perspective of the caregiver. In terms of those patient caregiver resources, we've got 2 videos from patients that had survived these CAFIs, as well as disparity resources, as well as COVID-19 resources in general. If we want to drill quickly down on 2 tactics, we did have to address the mucormycosis in India issue. And as you know, that was not something that was on our radar at the end of 2020. But in dealing with that, it seemed unexpected, but then we started to dive into the fact that there were high levels of mucor in India in general, as well as a problem with uncontrolled diabetes in India. And so the experts helped us kind of tease some of that out. However, there was a lot of confusion caused partially by the Indian lay press with this idea of the black fungus, which was more to do with the skin color than obviously the fungus. And there was also confusion of the role of durable medical equipment as a source. So there was really a need to educate quickly and help not only the healthcare providers, but the patients in that area. And as you know, India has some resource limitations regarding testing, access to surgery and treatments. To address this issue, we worked with Dr. Schwartz on a mucormycosis infographic that we developed with him and were able to get out within a week and a half in working with his Indian colleagues. And we hope to learn more about where we are in the state of mucormycosis in India. That has had 276 page views and 2.5 minutes average time on page. So that's been really successful. The Twitter open mic that Dr. Schwartz did with his colleagues in India drew 100+ participants. We set this up and he ran it within a week. And so many of the experts from India were able to get together with their colleagues and learn from the MSG and the CDC very early in the process. So that was great. We did a podcast with the IDSA that was a quick hitting podcast with Dr. Schwartz and Speck. And that collaboration and co-marketing really allowed us to extend the message. As I mentioned, we developed a kind of a color coding miscode, let's clarify this miscoding content. And we worked with Dr. Revankar on this, who's an expert in molds and different types of fungal elements and their colors. And we were able to get this out, and it has had 1,186 page views to date with 2.46 minutes on site. So I don't know if any of you do web marketing, but that's a really long time for people to be perusing content. The mucormycosis issue was also addressed in our first CE activity with Dr. Contianis talking with his colleagues about that as well. So that was great. In terms of the Kappa guidance, I think Dr. Patterson has done a really good job explaining this. One of our challenges is that the guidance for Kappa did not necessarily include a wide range of screening options that would reflect what's available in the community. So we wanted to really help people understand what diagnostic signal they might see from the microbiology and a flexible, easy to use format. So this care step pathway was actually initiated and worked through in the oncology space. It allows you for assessment, kind of grading criteria, and then quick hitting information for diagnostics as well as treatment. And so this was launched in 2021 on the website, but we've also done some hard copy distribution to UAB as well as to the community hospitals around Duke Medical Center. And that was at the initiation of Dr. Melissa Johnson. And to date, we've had 1,000 page views on the website and 2.41 minutes on the page. We also created a comprehensive reference companion guide that addressed antifungal stewardship and infection control issues with Dr. Ostrowski-Zeichner. I'm not going to spend a lot of time on the details of the CSP because Dr. Patterson did a really good job on that. But I do want to mention that we did illustrate the use of the CSP through 2 CME activities as well as the Critical Care Nursing Journal. And so those CMEs will, that are going to be promoted more extensively in the next weeks will really drive a lot of people to the care step pathway. Just real quickly to end up, we did an initial feedback on the CSP, and what's very interesting to us is that it is getting widespread use among intensivists, critical care pharmacists, advanced practice providers. We're in the very early stages of this survey, but we're looking forward to collecting more information and seeing how it's being used. What's really interesting to us is that 43% of the respondents said they are screening for Kappa, but some are treating empirically. Others are screening since they started looking at the CSP, so this is kind of a new idea for them. And some are not screening for Kappa because they don't think that there's enough of it. And then some are testing only in the presence of unexplained clinical deterioration. This was really interesting to us, again, with small numbers, but we asked people, what's your estimate of the prevalence at your institution? And a lot think that they're seeing about 1 to 2% of their patient population with Kappa. And then there's a little blip of people that think that it's greater than 10%. So I think it's really important that the MSG research and other groups get out there and help us to get a good handle on this prevalence. Most are actually found that the most helpful aspect of the CSP was screening, but the definitions of Kappa, which were made to be pretty inclusive without a possible category, I think were very helpful, but they also, wanted the clinical criteria and the guidelines for other IFIs. We don't know what impact it has made yet. Obviously, it's very early in the game, but at least a quarter thought it was decreasing mortality in terms of being able to recognize this. And then really people want to see more case reports on using the CSP, as well as getting to the bottom of this prophylaxis versus empiric versus directed therapy question. A lot of interest in mucormycosis, candidemia, and diagnostics in general. So I think the MSG is on the right track with some of the content that it's looking to do. So we're just really pleased that our activity has reached a large, diverse audience. There's still a large unmet need for education about the range of IFIs that can affect these patients. And we look forward to expanding the educational offerings with CA IFIs as well as more general fungal topics in the next 12 months. Just want to say thank you and really appreciate the opportunity to talk with you.
Well, thank you, Lisa. And we have a couple of minutes. Questions. I was looking. I don't have anything in the chat. No, we don't have anything in the chat at this point. Lisa, let me just ask you an open-ended question, and that is specifically, what do you see as what are the biggest challenges to reaching a larger appropriate audience, a target? What are the biggest challenges to reaching the audience that you really want to get to? Where do you see those, and how can we address those and try and fix them?
Yeah, so I think one of the things we've learned is that the intensivist audience really needs this education, as well as some of the ancillary members like the pharmacy, pulmonology groups. And so we have the ability to do some of that through our Google Ad Grant campaign, but also I think some of it has to do with having the faculty in place that represent their discipline, and so that they're hearing from their group kind of held up within that multidisciplinary framework. And so between the CME activities, which give us the opportunity to go to specific targeted groups, it's really bringing that, and I think the MSG's done a great job of bringing those specialists into the fold. I think Chadi was here, and we worked with Melissa Johnson, and now we're starting to bring some advanced practice providers in as well. So I think representation within activities that show the multidisciplinary care team are important, but also that ability to target through the continuing education activities, social media, those programs as well, and inviting those people to participate as well in the Twitter sections, because one of the things we learned is that's where a lot of the discussions tend to happen as well. So I think we've been moving in that direction with a lot of the MSG education recently, but I think it needs to continue, particularly during the pandemic. And I think having short materials that people can access quickly, because everybody is so busy. We saw people kind of get a little reprieve from COVID, and then, you know, with Delta, they got busy again. So I think having quick hitting education makes a difference as well.
Okay. Thank you, Lisa. And kudos to those who've really chipped in. They're too numerous to mention at this point, but I know you mentioned Delon, but all those on this advisory group have been, I think, very helpful. Okay.